So welcome. This is the 34th Annual Healthcare Forecast Conference, and we're very happy to have you. So thank you. Thank you already. You're starting the conversation. That's the point of this event. My name is Hope Schau, and I'm the Faculty Director for the Center of Healthcare Management and Policy, and this is our signature event. This event is designed to have a conversation about public policy at the national level, at the state level, and then do some kind of deeper dives in conversation. Today, we're going to be talking about AI and the obesity crisis and some solutions that we may have. We are hoping that you will be impressed and inspired by the agenda that we put in front of you and the speakers that we have, and that it will inspire you to have a conversation with our speakers and with each other. Judging by the conversations that we've seen already, I think that we are ready for that conversation. I want to thank, you've been seeing, scrolling ahead of us, that we have a lot of benefactors. The Center for Healthcare Management and Policy is an asset of the Merage School of Business. And so we also have a board, and the board is very generous in their funding. I want to mention two in particular, the California Healthcare Foundation and UCI Health, who are very generous in their sponsorship, but there are many others, and please look in your program to see all of the sponsors for us. They make this event possible. I also want to thank Christos Stremikis and Marie Ross and Diane and Ella for helping us with our program and getting all of the speakers that we have inspiring, hopefully a lot of discussion. I want us to think about this again as the beginning of a conversation. This is a conversation we're hoping that starts today and maybe inspires conversation that moves on forward. This is the beginning of something, I'm hoping. As I said, this is an asset of the School of Business, and it is my pleasure to introduce the Dean of the Business School, Ian Williamson.
Good morning, everyone. How are you doing today? Very good. So it's always very exciting when you can have an event that goes for 34 consecutive years. That's did not stop during COVID, actually. And so it is really impressive to see the vision that this center has had for our business school and for our community. And so I'm very appreciative of each of you taking the time to continue this tradition of having a rigorous, insightful, challenging conversation about healthcare, one of the most important things we can possibly have in our society. This is a center and an activity that I'm very proud of as the dean of our business school here at the Paul Merage School, in that it is a good example of the things that we aspire to do here at our business school. We have a mantra, if you like, of inspiring innovation through inclusion. And a lot of what that means is illustrated here today. And the inspiration part as an education institution is sort of creating a certain sense of dissatisfaction in our status quo, that we can actually do better, be better, see better things, and that we think education or education institution is a pathway for individuals to do that. So we want to inspire individuals to move the horizon just a little further than perhaps where it is today. And we believe wholeheartedly that innovation, technology-based innovation in particular, is a part of that, a solution, that the answers to many of the challenging problems we're facing today in society, many of those answers are going to come through some type of technology-based innovation, and we want our students to be very comfortable with that. And finally, this point of inclusion, and that by bringing together members of all the various different communities we serve, by creating a platform that all can benefit from, this creates the perfect environment for the innovative ideas to not just be created, but to flourish. And if I look at the work we're doing in healthcare, and much of that work is being led by our Center for Healthcare under Dr. Schau's leadership, it really illustrates that. You have some information in the packets that you were given about some of the work that our business school does in the healthcare space. It certainly is a very important part of our curriculum, both in our degree programs, our MBA programs, our Master's in Biotechnology Management program. By the way, I should take a moment there and ask, how many current students do we have that are here? Very good. So they're current students, people. That means they're looking for jobs. So current students, raise your hand again. All right, that means they're looking for jobs. So if you see a current student and you have a job, you should talk. I should also ask, how many alums do we have here? Zot. Very good. Welcome back. We really appreciate you taking the time to come back. I always say if a student has graduated and they still see fit to come back to their institution, we must have done something right. Something positive happened there. So definitely in our degree programs, this is a very important part of what we do. In our research, our Center for Healthcare here has been a leading entity in supporting the research of our faculty in this particular domain. More recently, really driving research that focuses on the intersection between artificial intelligence and healthcare in a wide variety of ways. So we're very excited about that. And then also, this is the perfect example, our outreach, making sure that the work that we do is accessible to the broader community. And for 34 years, we've been able to make this as a vehicle and open up the resources of the university to bring together individuals from all across the world. I know we have several individuals from outside the United States here today, to talk about the things that are very important to our communities and how we can be more successful in this. So I'm really grateful, I'm very honored that we're able to be entrusted to facilitate and curate this conversation. I'm very grateful that you've accepted our invitation to come. I do hope that you'll feel satisfied with the hospitality we provide you while you're here. And certainly if there's anything else we can be doing to support you, your organization, your community, please let us know. That is exactly why we are here. So I have one other job in addition to welcoming you. And I should also just say, can we give a round of applause to Dr. Schau and the committee that organized this? I know it's a lot of work every year to make this happen, and every year they make it seem seamless, but I know that's not how they experience it, so I appreciate all that they do. I also would just offer my acknowledgement to the sponsors for this event for their vision in supporting us, sort of entrusting us with their resources to ensure that this is a successful event. So thank you very much as well for that. So I have my last duty is to invite our next speaker, and he's someone I've gotten to know relatively well over the time that I've been here at UCI, and this is Dr. Steve Goldstein. And he has many titles. He is a nationally renowned physician, scientist, pediatric cardiologist, ion channel biophysicist, and I must admit, I actually don't know what that is, but I'm gonna find out. He lives down the street from me, so this is gonna be one of our conversations as we were in the neighborhood. And obviously, a very successful academic administrator as well. I've gotten to know him in his capacity as Vice Chancellor of Health Affairs here at the University of California, Irvine. In this role, he oversees our health enterprise, which is a very important component, not just of our university, but of our community. That encompasses our Susan and Henry Samueli College of Health Sciences, which is our School of Medicine, our School of Nursing, Pharmaceutical Sciences, as well as our School of Public Health, as well as our 6 research institutes, our Institutes of Health, as well as UCI Health, which, as I understanding, is the largest provider of healthcare in Orange County today. So we have a tremendous responsibility on our shoulders to ensure that we're providing the healthcare that our community needs. And much of that responsibility is actually on his shoulders. And so I'm very grateful, very grateful for him being willing to provide that leadership. He provides senior leadership in a wide variety of institutions around this country. He is an advisor for the National Institute of Health, National Science Foundation, and numerous other not-for-profit organizations that promote health and well-being in our country. So can you please just welcome Dr. Goldstein as he gives his remarks.
Thank you for that kind introduction, and the barbecue is ready, so we can talk about ion channels. Good morning. Thank you, Dean Williamson. So our challenge today is simple enough. We are to come up with a reliable near-term forecast of the healthcare, economic, and political landscape. No problem. As that great philosopher Yogi Berra said, it's tough to make predictions, especially about the future. Given the pace of events, in the nation, just seeing past the next news cycle is obviously a concern. But we must do our work here because the business of healthcare determines our capacity to care for our patients when they are ill and to support them when they seek to pursue wellness. And the best advice I have this morning is to remember that the principles that have allowed us to make good decisions in the past are still operative, even if they direct us to pursue different strategies in the face of new circumstances. So, with that, I'm going to leave aside a little bit of what's going on in DC and just make a few comments in that light about holding on to principles. Last year, I introduced our One Health model that supports our Discover, Teach, Heal mission in health, and noting a number of projects that were underway. And the results have been very encouraging and instructive, so I wanted to comment briefly on our progress. Our model is to operate as an alliance across health disciplines. Our schools of medicine, nursing, pharmacy, and population health, our research institutes, and the healthcare delivery system working together to amplify their individual goals and then together increase their impact globally while we improve efficiency and return on investment. So how we care for our patients tells us what we need to study and what we need to teach. And that creates a cycle of continuous quality improvement so that we can offer our patients the best every day, so that we can push forward the frontiers of knowledge and train future leaders. Often you've heard the phrase a learning health system, and ours is focused on access and quality. So that collaborative approach has led to four things that I want to mention in terms of choices made and direction. One of the more dramatic and exciting events is to increase access and service flexibility. We have created the UCI Health Community Network to complement our medical campuses that provide tertiary and quaternary care. We purchased 4 tenant hospitals and associated sites to become a regional system with over 1,300 inpatient beds and over 80 service sites. As Dean Williamson said, we are the only academic health system in Orange County. So that means we are a resource for advanced care for the 6th largest region in the United States. And up until now, many people leave to go to LA and San Francisco, and we are providing their ability to stay here in Orange County with access to excellence, but also the network will allow us to serve people closer to home and offer us service site flexibility, which we can talk about at some point. The second major step we made, which was very exciting, fulfills a dream of the founders of the university, which is to have a medical campus on the main campus near the teaching and research in all of the other disciplines that we bring to health. And the UCI Health Campus on Jamboree is opening up 1.2 million square feet. It has a building for outpatient and outpatient pediatrics and adult care, the Josie Wen Family Center for Advanced Care with urgent care, a center, the Schau Family Comprehensive Cancer Center and Ambulatory Surgery Center, and coming at the end of the year will be a specialty hospital of 144 beds, which has many unique features to it, not only being the first electric hospital in the world. In addition, and concurrently, the Susan and Henry Samueli College of Health Sciences is now complete with the 4 schools that we sought to have. And that's because the Regent approved our School of Population and Public Health. And the stellar faculty in those schools have increased our research funding from external sources for basic translational and clinical studies by 72% over the last 5 years. So we were at $415 million last year. The last thing I'll mention is our commitment in this Discover, Teach, Heal triad to a research building that's going to open up because of a $53 million lead gift from the doctor's ma. 215,000 square feet here on campus for basic and translational studies, which is uniquely organized around our One Health model, where clinicians and researchers will be together with new and existing faculty, and they're working on disease cures. It is 12 programs that are faculty designed that went through very extensive internal and external competition to get into the building. So we're very excited about that. We, in all of these ways, take responsibility for whole person, team-based, personalized care for all people, regardless of their ability to pay, as we train the next generation. And this is a unique opportunity and responsibility for a public academic health system. It's not as remunerative of, say, as taking only commercial patients. It's not as remunerative if you're not spending all that time teaching. It's not as remunerative if you're copying other people instead of advancing the frontiers so that your patients are getting the best as it comes to the fore. But we intend to continue to show the nation that this is the way you can do it by following our core principles. We will duck and weave as necessary to continue with our priorities. And that's the statement I wanted to make in response to where we exist today.